Have you heard of the term venous leg ulcer? Sounds scientific, isn't it? Let's break it down together. A venous leg ulcer is an open lesion that typically occurs on the inner side of the lower leg, between the knee and the ankle. This condition is caused by chronic venous insufficiency and ambulatory venous hypertension, fancy terms that mean the veins in the leg aren't working as well as they should. When this happens, healing becomes a slow process, often taking over a month. Venous leg ulcers account for over 90% of all leg and foot ulcers. That's a huge number. These wounds can have a significant negative impact on a person's life, affecting not just their health, but also their body image and overall quality of life. So how does this condition occur? To understand that, we need to dive into the workings of our venous system. Our venous system is a fascinating network that plays a crucial role in our body's functioning. Let's dive deeper into this intricate system. Picture it as a series of highways carrying blood from the body back to the heart. A remarkable feature of this system is its one-way valves. These act like checkpoints, ensuring that blood flows in the right direction towards the heart. They are the guardians against backflow, maintaining a steady stream of traffic on our bodily highways. But what happens when these guardians falter? When the valves are damaged or distended, they can't close properly. This leads to a pooling of blood in the lower leg venous system, much like a traffic jam on our highways. The result, an increase in venous pressure, or what we call venous hypertension. Now, let's zoom in on the legs, where we find two main components of the venous system: the deep veins and the superficial veins. The deep veins, including the femoral, popliteal, and tibia veins, are like the major highways. They carry most of the blood back to the heart. On the other hand, the superficial veins, which include the greater and lesser saphenous veins, are more like local roads. They collect blood from the skin and muscles and channel it into the deep veins. Connecting these two components are the perforator veins, akin to off-ramps or connectors, allowing blood to flow from the superficial to the deep veins. Together they form a ladder-like system, with the rungs representing the perforator veins. However, this system is not impervious to faults. Damage to the vein valves, such as in varicose veins or venous thrombosis, can lead to chronic venous insufficiency. This is a condition where the veins struggle to send blood back to the heart, leading to increased pressure in the veins of the lower limb. Now that we understand the venous system, let's look at what happens when things go wrong. Venous leg ulcers don't just happen out of the blue. There are specific causes that lead to this condition. Now let's dive into the causes of venous leg ulcers. The main culprit is chronic venous insufficiency, or CVI. This is a condition where the veins in your legs struggle to send blood back up to your heart. It's a common problem that typically occurs as a result of damage to the valves in your leg veins. You see, these valves have the important job of preventing blood from flowing backwards. They make sure your blood keeps moving in the right direction against gravity back to your heart. But what happens when these valves are damaged? Well, imagine a one-way street where suddenly cars are allowed to go in both directions. It would be chaos, right? The same happens in your veins. Damaged valves allow blood to flow back towards your ankle. This causes what we call venous hypertension. Now, don't let the term scare you. Venous hypertension simply means there's an increase in blood pressure within your veins. It's like a traffic jam in your circulatory system, with blood pooling in the lower leg venous system. This increase in pressure can lead to a number of problems, the most severe being venous leg ulcers. One thing we need to understand about venous hypertension is that it's ambulatory. This means it increases when you're standing or walking. The muscles in your lower leg, especially the calf muscle, assist blood flow towards the heart. But when the valves are damaged, this muscle pump system gets compromised. So every step you take, every move you make can potentially increase the pressure in your veins. So what happens next? This raised venous pressure can cause swelling and edema, or fluid accumulation in the leg. The pressure makes your blood capillaries and skin more fragile, increasing the risk of ulceration. It's a bit like when you overinflate a balloon. The more air you pump into it, the more stretched and thin the rubber becomes, until finally it pops. The main cause of ulceration is this very venous insufficiency, which results in increased venous pressure. Over time, this leads to a chronic inflammatory response, which can result in the breakdown of skin. It's a slow, gradual process, but the end result can be quite severe. Now let's connect the dots. In the presence of underlying venous disease, even a minor injury or trauma like a skin tear can result in a venous leg ulcer. It's like the straw that breaks the camel's back. Your skin is already under so much pressure from the inside, and then an external factor comes along and it just can't handle it anymore. With this background, it's clear how a minor injury or trauma can lead to a VLU in the presence of underlying venous disease. We've covered quite a lot of ground about venous leg ulcers. Let's take a moment to recap the key points we've discussed. Venous leg ulcers, often referred to as varicose or stasis ulcers, are open lesions that usually occur on the inner side of the lower leg, between the ankle and the knee. These ulcers are a result of chronic venous insufficiency and ambulatory venous hypertension, showing little progress towards healing within 4 to 6 weeks of initial occurrence. Venous leg ulcers account for over 90% of all leg and foot ulcers, which are generally due to venous, arterial, and foot complications with diabetes. These ulcers can significantly impact a person's quality of life, with the skin changes associated with venous disease negatively affecting body image. The venous system, as we discussed, has unique one-way valves that allow blood to flow against gravity and prevent backflow. Damaged valves or distension that prevents proper closure can lead to a pooling of blood in the lower leg venous system, causing venous hypertension. We also talked about the two components of the venous system in the legs: the deep veins, including the femoral, popliteal, and tibia veins, and the superficial veins, the greater and lesser saphenous veins. These are connected by perforator veins, forming a system similar to a ladder. Most importantly, we discussed the causes of venous leg ulcers. These ulcers are primarily due to increased pressure within the veins of the lower limb, often as a result of damage to the valves in the leg veins, or as a result of venous thrombosis. This increased pressure can lead to swelling and edema of the leg, increased fragility of blood capillaries and the skin, and an increased risk of leg ulceration. In the presence of underlying venous disease, even a minor injury or trauma can result in a venous leg ulcer. While venous leg ulcers may sound complex, understanding the basics can help us in early detection and treatment. Remember, knowledge is the first step to prevention and cure. But wait, there's more to venous leg ulcers than what meets the eye. Just as we peel back the layers of an onion, we'll be delving deeper into the fascinating and complex world of venous leg ulcers in our upcoming video. We've laid the foundation, understanding what venous leg ulcers are and their causes. Now, we'll be taking the next step, exploring the signs and symptoms that accompany these ulcers. From the early stages of a dull ache and swollen ankles, we'll walk you through each symptom, helping you recognize these signs and better understand the patient's experience. But that's not all. Diagnosis plays a crucial role in managing any medical condition. In our next video, we'll be shedding light on the diagnostic procedures for venous leg ulcers. We'll take you through the journey of a patient, from the first consultation to the non-invasive diagnostic tests, and the criteria that healthcare professionals use to confirm a diagnosis. And of course, we won't leave you hanging there. After understanding the symptoms and diagnosis, we'll be diving into the world of treatment options for venous leg ulcers. From conservative management strategies to the latest advancements in wound care, we'll explore the plethora of treatment modalities available, helping you understand their benefits and limitations. We'll also touch upon the importance of patient education and self-care in managing venous leg ulcers. It's not just about the treatment provided in the hospital or clinic, but also about the steps patients can take at home to speed up their recovery and prevent recurrence. So, gear up for an informative journey as we unravel the mysteries of venous leg ulcers. Whether you're a medical student wanting to broaden your knowledge or a curious soul with an interest in medicine, our next video promises to be an enlightening voyage into the world of venous leg ulcers. Stay tuned for our next video where we delve deeper into the world of venous leg ulcers. Catch you in the next one.